My name is Chris Mattern. I'm a neuroradiologist and I'm the president of Greensboro Radiology.
Hi, I'm Sriyesh Krishnan. I'm a body imager with Greensboro Radiology, and I'm also the vice president of operations. We're excited to talk to you today about our partnership with Cardinal Points Imaging here in the Triangle. Greensboro Radiology and Cardinal Points Imaging both think it's very important to have radiologists at the center of patient care, and that requires a physical presence. So we're continuing to staff all 4 sites in the Triangle area with radiologists on site. It's important to know that those radiologists live in that community, both here throughout North Carolina, but that we live here, our families are here, and that we treat these patients as if they are our own family members.
That's right. We've got radiologists that are living in Raleigh-Durham, as well as radiologists that live in Greensboro. We can use all of those radiologists to make sure we've got just the right radiologist reading each and every study that we do at Cardinal Points Imaging. Together, we share a mission of keeping the patient at the center of everything that we do. That means we're taking a look at each and every patient, making sure it gets to the right radiologist. It means that we're communicating directly to each of the referring physicians so that we can give you the information that you need in a timely fashion to take care of your patients. It means that we've got a support staff that you can call a single number to get a hold of any radiologist and any specialty that you need. We actually have radiologists available 24/7 to answer questions even after hours.
So we provide a single phone number, which we call the RAD line. And so that way, if the referring clinician has a question before, during, or after a study has been performed, they can reach any of us to get the right person at the right time to address that question or concern.
As a mission-driven organization, we are constantly talking to each and every one of our RADs about what we do every day, about how we bring that patient care to our work, how we show up each day. We all have good days, we have bad days, but we know that we're there for the patient every single day. We're accountable to one another. We make sure that we bring our integrity to our work every time we talk to a patient, every time we talk to a referring physician, every time we talk to a patient's family, so that we keep that right at the center. We make sure that we are bringing our excellence every single day so that we can bring the best that we have amongst our 80 radiologists to get the right subspecialists to that case at the right time to deliver the best care.
We want to be a resource for every physician in the Triangle area, so that if they have a question or concern, they can come to us and we can be a consultant for them on what is the right test to order, what is the right next step in care delivery for their patients. And we think with Cardinal Points Imaging, we can be that resource.
Every one of our neuroradiologists has a special board certification in neuroradiology. That means every single brain MRI that we do is only read by a neuroradiologist. Every single neck CT that's done for head and neck cancer or other disease of the neck is only read by a neuroradiologist. We keep that in a small group that helps us to keep great quality control. The same applies to our musculoskeletal section. We have dedicated, specially trained musculoskeletal radiologists that are reading each and every single joint MRI and CT that's done at Cardinal Points Imaging.
We deliver the same level of care when you order a cancer CT. So oncologic care is all performed by a dedicated group of body imagers. Urology care or GI care, also, we make sure those studies are all routed to a dedicated pool of body imagers. At Cardinal Points Imaging, we know you have lots of choices on where to send your patients. We want your patients to be able to stay in their communities and get their care locally. We know that if you send your patients to us, that you will be more than excited about the high level of subspecialty care and the prompt care delivery that you will get from a dedicated team of subspecialists who live in your community and know your patients and their families.
With our entire practice of radiologists, we have specialists in every single field. As a subspecialty physician, you're going to get to know the physicians in our group that serve you. If you're a neurosurgeon, a neurologist, we'd like you to get to know our neuroradiologists. If you do breast care, we'd like you to get to know our mammo doctors. Although we're a large practice, there's a small group that's going to be serving you, your patient's needs, and your practice's needs. Give us a call. We've got a simple line to call us. If you have any questions, call Sriyesh, call me. Let us know what you need. We're going to be there for you. We're in this together.